Hello parents, myself Dr. Anupriya. So in this course we'll discuss about the things every parent should know before giving bath to their baby. So let's first start with the essential bathing items. That is, we are preparing for your baby's bath. So first one is the baby's bathtub. So you need to choose the ones which are specifically designed for newborns. It has a sloped or contoured design which can support the baby's back and a sturdy base which can prevent tipping. Second, soft wash clothes. You can have at least two in your hand. One for baby's face and other one for the baby's body. You can opt for the ones with soft, absorbent materials like cotton, bamboo. Third, mild, fragrance-free baby soap and shampoo. Baby's skin is very delicate. Make sure you choose the ones which are specifically designed for babies, which are free of harsh chemicals and fragrances that can irritate your baby's skin. Fourth is baby safe bath thermometer. So baby's water temperature should be around 38 degrees Celsius. So if you have this, you can just set at the correct temperature. Fifth is cup or pitcher for rinsing. So you can use this to pour water gently over the baby's face to rinse off the soap. Sixth, soft towels. Have at least two in your hand which are soft and absorbent and are ready to dry your baby. The ones with the hoods are comfortable and will keep your baby's head warm. Last one, clean diaper and clothes. Make sure you have a clean diaper and a change of clothes for after the bath. So next is preparing for the bath. You check the water level. You can fill the tub with 2 to 3 inches of water. This should be enough to wash the baby without submerging them completely. Secondly, check the temperature of water. So you can use your elbow or the bath thermometer to check the temperature. It should be warm, not hot to touch. Lastly, gather all the supplies. Make sure that it is within your reach. It will ensure baby's safety and minimize distractions. Baby's safety while bathing is very important. So for that, never leave the baby unattended. Firstly, you need to have constant supervision. Do not leave your baby alone in the bathtub. They can drown even in shallow water. Second thing, you need to minimize your distractions. Like you can gather everything together at once before you start giving bath to the baby so that you don't have to leave the baby alone. Always support baby's head and neck with one hand while you give bath with the other. It will prevent their head from slipping or falling back. And lastly, use a non-slip bath mat or a towel at the bottom of the bathtub so that the baby doesn't slip. And keep the bathing area dry and free from clutter to prevent slips and falls. So when to give sponge baths? Sponge baths are recommended until baby's umbilical cord falls, which happens usually in the first 1 to 2 weeks of life. You can also give sponge baths in between full baths in the initial few days when the babies don't get very dirty. Now coming to the bathing technique, step-by-step guide. So first of all, gather all the supplies, undress the baby and wrap them in a towel to keep them warm. You can start by wiping baby's face with a clean, damp cloth. Use separate corners for each eye to prevent spreading any germs. Using a different washcloth, apply a little bit of baby soap all over the body, paying special attention to the creases and folds. Again, for rinsing, you can use a clean, damp cloth. Make sure that no residues are left over at baby's skin. Now drying, you can pat the baby dry with a clean towel. Make sure to dry the folds and creases. If you're using a hooded towel, make sure to put it over the head to keep the baby warm. And then put on a fresh diaper and dress. So tub baths. Once the umbilical cord falls and the area is healed, you can start giving tub baths to your baby. Start with small sessions and gradually increase as the baby gets comfortable. So a step-by-step guide to the tub baths. First of all, gather all the supplies. Fill the tub with 2 to 3 inches of water as mentioned before. And slowly lower the baby into the tub with supporting head and neck with one hand and gently swish water with the other hand. Now, if you're washing baby's hair, take small amount of shampoo and gently massage over the scalp. And then you can use the cup to rinse the shampoo thoroughly, avoiding getting it into the eyes. Now, how do you wash the body? You can take small amount of shampoo on the washcloth and gently wash baby's body, paying attention to the creases and the folds. And then you can use the cup to pour water over the body to rinse. And once that is done, carefully lift the baby up and take out of the tub and wrap them in a towel immediately to keep them warm. And then pat the baby dry with a dry towel. Make sure you dry the creases and folds. And then you can put on the diaper and fresh clothes. While buying soap for a baby, make sure you check the following things. The pH is 5.5. It's tear-free, chemical-free, fragrance-free and plant-based if possible. Do a patch test before you use it. Special considerations. First is umbilical cord care. So until the cord stump falls, you need to keep it clean and dry. You can take a damp cloth and clean the area around the stump and pat it dry. Avoid submerging the stump until it's fallen and healed. Circumcision care. When you give birth to the baby, you can just clean the area with warm water. Avoid applying soap over it. After the bath, you can apply a thin layer of petroleum jelly to prevent it from sticking to the diaper. Now coming to summary of this course. According to the American Academy of Pediatrics, giving tub bath twice a week is enough. Always use baby-friendly products. Check temperature of the water before giving bath. Never leave baby unattended and avoid tub bath before the cord has fallen. Thank you.